Good afternoon, everyone, and welcome to LGBTQ plus Health Grand Rounds. My name is Wei Chen Ling. I use she, her pronouns, and I'm the program manager for Stanford Medicine's LGBTQ plus health program. For visual description, I'm a Taiwanese woman with medium-length black hair and a little clip today, wearing a cool tone lavender cardigan over a black and white striped shirt. And I'm thrilled to be sharing the Zoom stage with our very esteemed presenters and my collaborators, Bláz Bush, Jessica Whittemore, and William Bottini. The four of us are very proud to represent Stanford Medicine's educational technology team and the LGBTQ plus health program in sharing our newest free, online, publicly accessible educational resource titled Teaching Gender-Affirming Care, a case-based simulation to improve transgender health outcomes. Please note that this session is being recorded and will be published on the Department of OBGYN's public YouTube channel. So if at any point you would like to share comments or feedback but want to stay anonymous, you can feel free to send me a private message in the Zoom chat. And for your convenience, we'll highlight a few of Zoom's built-in accessibility features to ensure that everyone can fully participate. Zoom offers live automatic captioning, which you can enable by clicking the Show Captions button on the Zoom toolbar at the bottom of your screen. If you don't see this option, you might have to click the More menu with the three dots and select Show Captions from there. And you can adjust the size and appearance of captions in your Zoom settings under the Accessibility menu. We encourage you to explore these tools and use what works best for you throughout today's session. And if we can help meet any additional access needs, please feel free to reach out to me via the chat at any time. Throughout the presentation, please as well feel free to add comments and questions directly in the chat. I will be monitoring the chat and will uplift any timely, immediate questions during the session. Otherwise, rest assured, I will aggregate these for our Q&A section at the end of the hour. And I know many folks prefer hands-on learning while they're tuning into the presentation. If that's you, I'll be providing the link to the game in our chat shortly once we get started. And with that, I'll pass it on to my lovely collaborator, Jessica, to get us started with presenter introductions.
Good afternoon, everyone. My name is Jessica Whittemore. My pronouns are she, her. I'm an instructional designer with Stanford Medicine's EdTech, and I'm so excited to be here today with you and to have been working on this truly dream of a project for the last couple years. My visual descriptor is that I am a white cisgender woman with this month blue hair, wearing an oversized button-up shirt with a sweater clip at my collar. I'm a queer woman and I have a background in environmental justice. And I have been most proud in this job of working on, thanks, working on gender-affirming communication and now this gender-affirming care course. And I would also like to say that I am a theater gay. Hello, it's nice to meet you.
And William, feel free to go next.
Thank you. Hi, everyone. My name is William Bottini. My pronouns are he, him. I am a cisgender straight white man, and I'm wearing a tan two-piece, but you can't see the bottom of it. I am the creative director of EdTech, and I was the game designer, one of the writers, producer, and director of this project. I've been developing LGBTQ plus health content at Stanford for the last 8 years. I'm very proud of that and happy to keep innovating and spreading this work. Thank you.
And hi,
everyone has...
everyone. Go ahead, Wei Chen.
Okay. You all have already heard from me, but again, my name is Wei Chen Ling. I use she, her she, her pronouns. I'm the program manager for the LGBTQ plus health program. I'm a queer Asian immigrant woman. My background is in STEM teaching. I used to be a middle school science teacher, and I'm currently doing my doctorate in education, researching LGBTQ plus Asian American college students' experiences and identity development across their educational experiences. So this has been a very meaningful project to contribute to. And now, Bláz.
Thanks, Wei Chen. Sorry, I got so excited I almost cut you off, but didn't mean to. Hi, everyone. My name is Bláz Bush. My pronouns are Bláz or he. I have the honor and privilege of being the executive director for the LGBTQ plus health program here at Stanford Medicine. I have no financial conflicts of interest to disclose. I'm queer. I identify as genderqueer. I'm white. I have ADHD, which is why I get excited and can't hold my impulses back. I'm devoted to LGBTQ plus affirming healthcare work. I've actually been doing this. That's actually closer to 16 years now. I started in 2010, and I've been working in strategic programs, education, and research during those years. Also, you can always talk to me about cats, video games, astrology, or tarot. These are a few of my favorite things. I'm also a theater gay. And for my physical descriptor, I'm white, have a short beard and kind of textured, messy hair. You can't see them, but I have glitter all over my face. And I'm wearing a Stanford Medicine LGBTQ plus health program denim jacket with a cute rainbow heart on my sleeve and a Muir Woods button-up green shirt below that. And I get to start us off by going through some of the early content and how this came to be. And this project is officially a dream come true. As you can see, I love video games. And of course, I'm very passionate about this work. And so I had thought about how can we create something to really get this education out to people and making it accessible and engaging. But we'll get into more of that in a minute. So for our agenda, I'm going to take us through the context and current landscape. Our ed tech collaborators will take us through the design process and our patients that we focused on. Then a gameplay overview, so you actually get to see what this looks like. And we call it a gameplay. It is also highly educational. So we use game in the utmost educational, respectful form. Practical curricular application will come next. And then we also have a lot of exciting future directions we'd like to take the project in. So what is our rationale and the context? So many folks here might know some of this, so I'm going to move through this somewhat quickly, but just understand that LGBTQ plus healthcare is challenging, and honestly, we were making a lot of progress, and in the last year and a half, you all can put together the pieces. It's just become worse and worse and more difficult. We see that about 9% of adults identify as LGBTQ, and over double that in Gen Z identify as LGBTQ. So a lot of people think we're a small population, and we are not. And so a lot of folks, I think, I use this as a way to say, listen, we're really behind on meeting the need of a very large population and growing population. Because of that, we have significant health disparities. And there's a lot of barriers to accessing care. And again, especially for our transgender and gender diverse folks, they're literally having their care taken away from them right now across the US and honestly, parts of the world. In some statistics, half of all LGBTQ plus respondents said that they had intentionally delayed, skipped, or avoided a medical exam in the past 12 months. So half of all of this community are not seeing the doctor. And that's one of the big things we'd like to address. And again, half of all transgender respondents, but actually around 70% of trans folks of color report at least one instance of discrimination or mistreatment from healthcare providers. So we wonder, why don't LGBTQ folks, especially trans folks, want to go to the doctor? Because it's a horrible experience. And then what do we know about that? So how do we get better at serving this community? Well, that has to happen through education, right? But right now, med students report receiving approximately 2 annual hours of LGBTQ plus education, even though the national average back in 2010 was around 5 hours of curriculum. Most med students aren't seeing all of that. Most gender affirming care is often limited to a single lecture. What do we know about practicing medicine, especially with communities where communication is really important and sensitive? You need practical training. You need to be able to sit down and get this language in your mouth and work on it. But there's really minimal opportunities for that in med school. And we'll talk a little bit more about that in a moment. And so there's also just a lack of exposure to LGBTQ plus patients during their clinical rotations. You really need a large LGBTQ plus clinic and with folks that have time to do education around that. And that's extremely rare in the US. So that means that providers have discomfort and avoid this care or these patients. I've heard folks here at Stanford say, not necessarily providers, but healthcare workers say, if I think a patient's trans, when I go into their room, I just won't acknowledge or speak to them because I'm afraid of saying the wrong thing. So we see that there's a well-intention there. They don't want to say the wrong thing, but there's a discomfort and avoidance. And of course, a patient feels and experiences that, right? Which means we have suboptimal or harmful care, which only leads to more healthcare disparities. And we lose those opportunities for any kind of affirming relationship between the patient and provider. And how do we currently do this? So a lot of lecture-based learning, but again, you might have one session on this. It's also very passive. You need to listen. You've got a lot of other things on your mind. It's also not often tested in medical education, like in the STEP trainings. So it's also could be seen as an optional thing if you're stressed about your other exams and criteria. Um, it's very hard to have standardized patients, which is really where you get that practice. And there's a lot of conversations in standardized patient work about how can you do this ethically. We really need somebody with the lived experience of a transgender patient to kind of role play a standardized patient for people to practice on. You can't just have somebody who's cisgender step in and play at that character. It's unethical, it's offensive, and they just don't do it justice. It's not the same thing as having someone who's really lived with that. But standardized patients, the work is a little bit infrequent, and depending on where you are, can be difficult to get into, or if there's a low population in the area. So there's a lot of, I would say the majority of places that just don't have a standardized patient to practice with. And of course, if you are trans and going in to be an SP, you've got like 100 to 160 med students who are practicing these skills for the very first time on you. Sadly, it may not feel different than any other medical care you're getting anywhere else, which could be extremely traumatic and re-traumatizing to go through. So it would be difficult to sign up for. And so also on the provider side, where do you get to practice these skills safely? Are there opportunities? Does your institution build that up? Do you feel comfortable asking for that? If not, you may practice this with a patient for the very first time. And we know that's just never optimal. We also have a lot of missing identity aligned perspectives. So a lot of this content is created by people without LGBTQ and especially transgender, gender diverse people building the content or involved with how it was put together. So what do we need to address all of this? It's got to be interactive. It's got to be authentic. It needs to be evidence-based. And we need to have identity affirming learning experience. So first, if you haven't heard about kind of the predecessor to the Teaching Gender-Affirming Care, we have the Teaching LGBTQ plus Health course. It is currently available online. It's a great start to learning about LGBTQ plus healthcare broadly. It's free. It offers CME. It's popular. It's cute. So if you haven't done that, go check it out. I went through it whenever I started at Stanford. I had a great time, and it tested even some of my skills. So I really enjoyed it and encourage all of you to check it out. And you won't be alone. Approximately 5,000 users have engaged with this to date. Statistically significant improvement in test scores of 30% or higher. Almost all participants intend to change their clinical practice because of this course. The sentiment analysis demonstrated that almost all participants achieved the learning goals of the course. And we've had consistently outstanding course evaluations across the 2 years that they were analyzing this. So it's really well received, and you can see some of the benefits there. So encourage everyone to check that out. So moving off of that, we wanted to see what could we do next. And we wanted to build something that addresses and dives into gender affirming care. So The big pieces around that is we wanted people to be able to practice these clinical skills. We wanted to make it so that whether or not you had a standardized patient program that had somebody who's trans or gender diverse, you really got to make choices and see how that landed on the patient and have to test your own clinical skills and understanding. We also wanted it to be more like hormone care is a piece of this, but how does hormone care interact with the rest of the patient's life? Including their own comorbidities, for example. So honing some of those clinical skills, but also building the empathy part. We know that change often comes from empathy and empathizing with patients and people. So we wanted you to also see what is a patient's experience outside of your clinical encounter with them, because we feel like that's something that a lot of people miss about these patients and just how important this is to a person's life, how it can fundamentally change the way they move through their world and through their relationships, through their workplace as well. And so we wanted to build that into a learning experience. We want to make sure that it's just not like one of our Stanford health stream trainings that you just want to click through. We wanted to pull people in and not only just click through, but in fact, we want you to want to replay it. So we wanted to create a structure where you could see different outcomes and how that changes based on what you choose to say. And again, we want you to engage with the lived experience of these patients. So this was the learning gap. We've kind of gone all over all of this. We were trying to meet that this issue of most people not ever being taught around this, that there is a high demand for this, that there's a high population growth around this community. And really, it's just been incredibly difficult to get this into medical education, because if the faculty were never trained on this to begin with, then how are they supposed to teach this to other people? And that's the gap we're trying to address. And so we went to ed tech and said, what can we do? And ed tech's like, we got you. Let's create the most beautiful thing you've ever been a part of. And they did. And we launched it in 2026. It's called the Teaching Gender-Affirming Care, a case-based simulation to improve transgender health outcomes. And with that, I will hand it over to our ed tech team.
And I apologize in advance. I'm feeling a little emotional today, but I'll try to rein it in. This means so much to us, and I'm so glad to be here again. So Bláz and team came to us with a dream, and we took that dream and started our course content development with anonymous interviews of transgender and gender diverse patients. We're on the next slide, Wei Chen. They shared with us stories about their identity and harms, both big and small, and dreams for what affirming healthcare could look like. And I will say that having participated in some of those interviews, I was told multiple times that that was the first time that they'd gotten a chance to even think about that. Like, what would this look like if it was good? And certainly the first time that anyone had asked them. Then the practicing physicians on the content team mapped their best practices and the technical needs that they've observed after years of caring for TGD patients onto the stories that were shared in our patient interviews. Then LGBTQ plus medical students helped write the content with the content team to write out our patient cases with constant input from TGD physicians and additional practicing physicians to confirm our clinical information. And we're also very grateful to our clinical reviewers and playtesters from all of these communities who provided feedback and are still providing feedback. And if you have feedback, we'd love to hear it. Our patient cases are all designed to teach specific gender-affirming principles and treatment options. They were all collaboratively created and then refined with the help of our voice actors and artists, who are all also gender diverse individuals. We'll have more on that later. So the need for this course is clear, as evidenced by the learning gap spanning generations. Next slide, Wei Chen. And most healthcare providers were never trained to care transgender and gender diverse patients. And as a result, generations of physicians and educators lack understanding of gender affirming principles and treatment options. And despite the high demand from students and patients, medical education has been too slow to incorporate LGBTQ plus health into curricula. And this is especially true of practice-based training. So creating standardized patient experiences, as Bláz mentioned, that are authentic, representative, and not traumatizing to the trans actors is particularly challenging. So our solution and hope is that this Teaching Gender-Affirming Care course provides educators, physicians, and students all over the world the opportunity to do safe, deep, immersive, repeatable, practice-based training on these skills. We currently have 18 unique patient visits across 8 patients, which would give learners about 5 hours of CME credits. And as with in-person simulation training, learners must make many choices about how they interact with the patients, each with the chance to greatly affect patient trust and stress. So the overall course objectives for this training, next slide, were a struggle to come up with because there was so much that we wanted to incorporate into this course. Each visit has its own set of objectives, but when it comes down to it, they all boil down to these 4 main objectives. So by the end of our training, learners will be able to demonstrate inclusive, patient-centered communication strategies that affirm the identities and experiences of transgender and gender diverse individuals across the lifespan. Apply knowledge of gender-affirming medical therapies, including testosterone and estradiol regimens, to support individualized transition goals while managing associated clinical considerations. They'll be able to identify ethical, legal, and institutional considerations in the care of transgender and gender diverse patients, including confidentiality, consent, and documentation practices. And they'll be able to describe the implications of gender-affirming care on reproductive health and fertility, and counsel patients on preservation options and long-term planning. So the clinical foundation for our training is in alignment with the World Professional Association for Transgender Health, or WPATH, and their Standards of Care version 8. In particular, we cover WPATH topics such as assessment and prep for gender-affirming medical interventions, hormone therapy initiation and management, surgical considerations and readiness assessments, mental health support and evaluation, adolescent-specific care guidelines, informed consent models, and multidisciplinary collaboration. And due to the current federal administration's unscientific attacks on certain keywords, we did remove most of the references to WPATH within the game dialogue. So it isn't searchable, but the standards of care are there because they are foundational and best practice. Okay, so as mentioned earlier, we built this course so that healthcare providers could practice caring for TGD patients without traumatizing real TGD patients or standardized patient actors over and over. So we wanted to make the patients feel as real as we could. One of the huge challenges and opportunities for this course was the beautifully massive array of identities and lived experiences of gender diverse people, and choosing what type of people and stories to include in the course content is something that I'll say we were never really happy with because we always thought that we should be sharing more and could be sharing more. So the only way that we could work towards being happy was in doing extensive character research through referencing the lived experiences of ourselves and people we know, reading books and watching videos, movies, and Instagram reels, listening to podcasts, spending way too much time on Reddit, and conducting anonymous patient interviews to redundancy. And as best as our staffing limitations could allow, we also matched writers with characters that they had a personal stake in and got iterative feedback from people in the community. We made special effort to avoid harmful stereotypes while still holding space for discussing those stereotypes and exploring intersectionality. So here are our three main patients. On the next slide, we have Olivia Lee, they, them, 16, is an energetic non-binary teen who loves soccer, boba, and K-pop. Like everyone, they deserve safe access to a restroom. Rock Garcia, he, him, 26, is a young Latinx trans man and gym rat. As he finds the courage to begin hormone therapy, he learns to trust our healthcare provider, lean on his sister, Ella, and accept the help of a therapist. Viola Phoenix, she, her, 35, is a trans woman, influencer, and aspiring filmmaker. On top of film school, she's dealing with various health issues that stem from her busy lifestyle. We couldn't possibly cover all the various healthcare needs of the TGD community through just those three characters. So we also included 5 side quests in the form of single encounter cases. These are one-off patients that expand our demographic and clinical representation and presentation. We also found demographically appropriate trans voice actors to provide the voices for all of our characters. We do still need more funding to complete the recordings for dialogue within all of the visits, which is a goal for us to support course accessibility, but we have recorded voiceover for some of our content that William might talk about later. And these actors and artists were also invited and compensated to provide feedback and edits on the cultural sensitivity and authenticity of the content and dialogue. So none of our trans actors had to say anything that felt bad to them to say. Like any qualms, no qualm was too small for them to say, you know, I don't feel like I would say this, or I don't think this represents me well. We were able to accommodate that sensitivity and authenticity. And so this means that between our initial character research and the stream of community feedback, that we can feel confident about what we've said and how we've said it, which doesn't mean that we're perfect or not still accepting future feedback, but we are very proud of these 3-dimensional 2D characters that we've created. And now I invite William to tell us more about the game.
Thank you, Jess. All right, let's do this. I'd like to walk you through the gameplay, and it all starts outside of the Roseway Clinic, the heart of the Teaching Gender-Affirming Care game. The Roseway Clinic is on a mission to improve its care practices for its growing gender-diverse patient population. When our learners start the experience, it's their first day at the clinic. And under the mentorship of these 2 characters, Dr. J and Dr. G, learners will be providing primary care to 8 gender diverse patients, as Jess got to share. And they will be coached by these mentors as well as other staff at the clinic on communication skills, interpreting labs, navigating referrals, family planning, and also managing dynamics of the internal clinic environment among their colleagues. And the primary experience is speaking directly to patients, making choices about what they say and how they say it, and getting live feedback about how that impacts their patients' stress and their trust, and getting to see into their lives about how the care decisions you make in the clinic affect the rest of their lives as well. So because this narrative and the world of the game is so important to us, the interface of the game is integrated into the world. So our learners select patients from the waiting room, not from a menu. And as the player progresses through the game, new patients become available in the clinic, and the learner can choose which patient to see at any given time, enabling them, as you may know, goal-oriented adult learners to choose how they pursue their time in the experience. For example, a player could focus their time on a single main character like Olivia, and see them multiple times in a row, or they might jump through multiple patients and get this different experience that they choose. When you select a patient, you will see the details of the visit ahead, including learning objectives, the time it takes to complete the visit, and a recap of what's been going on in the players or in the patient's story thus far. Because as we shared before, this is ended up being quite a big experience, about 5 hours of gameplay. So you might need to get caught up every now and then. Continuing on, each patient visit includes an electronic health record entry with information that will be reviewed ahead of the visit. It'll be available during the visit as well. And this is updated. If you see a patient multiple times, this changes and evolves as well. And before each visit, you also have the option to get coached on patient care relevant to that visit. So our in-game version of Dr. Gisandi will ask you questions related to gender-affirming care, coach you through, give you feedback, and in our game experience, you'll be able to choose how you navigate this coaching experience, or if you want to skip it, which enables beginner learners and more experienced clinicians alike to test their knowledge or sharpen their existing expertise, and once again, pursue their learning in their own way. Moving on to the patient visit itself, you will make decisions about care and communication alike. You'll get to see in real time how this affects the patient. They will respond both visibly and through a trust and stress meter that is optionally available on screen to what you say and how you say it. And we've designed these questions to be somewhat challenging and nuanced. These aren't your typical multiple choice questions. So we are utilizing the learning concept of desirable difficulty or productive failure to strengthen the learning experience by engaging folks' critical thinking throughout the patient visit and enticing them to try again. So after each visit, learners have the opportunity to get debriefed on their performance as established by Stanford's own simulation center, Dr. Gaba and Dr. Fanning. Much of the learning in simulation happens during this debrief. So we've made this a rich experience where players will get to review the choices they make or didn't make and think through how they could have done something differently, and they get to try that again if they want. One of my favorite aspects of the gameplay is the graphic novel style vignettes about each patient between each visit. We have over 100 pages of graphic novel in the book, in the game. And in these vignettes, you get to see how your care decisions impact the characters' lives. We've included these because building empathy and building exposure to all sorts of patients is a goal of ours as well. And these provide a break from the learning experience as well. And you can watch or read these. These took on a huge importance for us. This was an opportunity for us to engage the gender diverse community directly and hire them to work with us to co-create the content, to add their own voice to these stories. And as Jess mentioned, every single one of these illustrators was also a subject matter expert because they were experts in their own identity and the experience of the characters that we selected. So I'll just show a couple more slides here. You can see, for example, this is one of my favorite stories is the story of Rock trying out testosterone and seeing the results over months and years. And in the next slide, you can see that we tried to capture the joy and tried to capture the wonderful moments. That's really what we want to express through these vignettes is that the human experience that is behind the clinical practice. And if you go on, it's quite fun too. As a as a cis man, and knowing that much of the audience that we're trying to reach through this experience may not be gender diverse, we also have quite the community around our patients that you get to see, including Rock's older sister here, who is teasing, but also very supportive and a mentor figure to him. Moving on, as you see patients, you unlock awards and decor to improve the clinic and make it a more inclusive space. And in the next slide, you'll see swag as well that you get to add to your ID badge. This concept in particular came from our early observations of the Stanford LGBTQ plus health program, where we noticed how staff decorated their badges. There we go, Wei Chen and Bláz, to make their positions known and to make the space inviting to their community. So we brought that intentionally from Stanford's real clinic into this clinic. And we use the concept of game achievements through the badge swag and the decor to incentivize people to play. So you can see there's a little snippet of some of the achievements that you can get. As we established at the beginning of the game, Roseway Clinic is a work in progress, as are we all, as is this whole mission. So you get to make that real through the literal improvement of the physical space that you are in the game. And if you advance one more, you'll get to see an exciting aspect of this project, which is that we partnered with the Human Rights Campaign to ensure that Roseway Clinic could earn its really prestigious designation as an LGBTQ plus healthcare equality leader. So the game itself, the clinic is the very first virtual clinic to receive this designation, and we worked carefully with them to ensure that we went through their criteria of what makes a clinic a healthcare equality leader, and we're very proud of this. And that's a little bit of a look through the game, and I'll hand it off to Wei Chen to keep moving us forward. Thank you.
Thank you so much, William. And just want to plus one how meaningful and impactful those vignettes are. When we were doing play testing for the game, there were several folks who were leaving the room like crying out of just pure joy and connection and resonance with the vignettes. I will say the game is almost worth doing just for the vignettes alone, but the clinical content is, of course, well researched and many hours spent poring over this hundreds and hundreds of pages of script. So, what I'll tell you a little bit about is beyond playing the game, what are some ways you can practically apply the information that is taught? And if you are a medical educator, if you are in charge of education or curriculum, how could this practically integrate into what you are doing now? So I'll start by talking a little bit about our target audience and implementation. Really, there is no one who can't play this game. I myself, as a non-clinical person, wanted to make sure that this was something that was accessible to folks without a clinical background. So do rest assured that even though there is clinical content embedded in these scenarios, as we want people to take away clinical best practices, that you will receive pre-coaching on every clinical question that's asked. So even myself, as someone without medical training, I was able to move through the questions with the pre-coaching and get those correct answers, move on to the patient visits, etc. And I feel like I personally learned a lot from doing this project as well. The course is, of course, geared towards folks with a medical background. For example, faculty educators. This is a great course to do a train the trainer type of model where faculty can learn how to teach teaching gender affirming care content and serve a similar role as Dr. Jasandi in the game to provide this mentorship to up and coming clinicians or peers as well. This can also, as you might be able to see, easily integrate into training curriculum for medical students, for trainees and subspecialties and specialty programs, nurse practitioners, PAs, psychologists, social workers, really anyone who touches healthcare at all could benefit from this training. And of course, this could implement well in terms of embedding in LGBTQ plus curricula as homework or pre-work for folks to do before coming into class. You could also utilize case studies or particular patient reviews, tracking one patient over the course of 5 visits, or picking out one of those single encounter cases that best applies to your context. So for example, for OBGYN, which is the department that the LGBTQ plus health program belongs to, we could extract the single encounter with queer family planning to be most relevant to that curriculum. This would also be great in orientation and onboarding programs to teach some of those inclusive communication strategies, as well as to prep for clerkship before folks start seeing patients formally and independently. And of course, for your own professional development, this is a great place to get more information around caring for trans and gender diverse patients. And we've mentioned a little bit about how the teaching gender affirming care game was designed with clinical best practices in mind. You might be wondering what some of those best practices are. Here they are on the screen. I will say this is a selection of best practices that we've extracted, and I won't go through each of these points now. But some of these broader themes of key best practices around caring for trans communities include normalizing and facilitating identity sharing. For example, introducing yourself with name and pronouns and asking patients for their name and pronouns. Leading with universal precaution, not necessarily having the asking of name and pronouns or consideration around gender neutral language be exclusive to folks you perceive as perhaps part of the LGBTQ plus community, but really defaulting to that for broader inclusion and defaulting to the organ inventory for clinical decision making as well, rather than relying on gender or sex assigned at birth to make those decisions. Two more broader themes include giving patients autonomy for decision making, really grounding in the fact that providers and staff role is to support patients in reaching their goals, whatever they may be, rather than dictating what gender affirmation goals should be. And really emphasizing shared decision making, leading with questions like, what are your goals for gender affirmation, rather than assuming there is one linear way to do so. And finally, of course, addressing the whole person, understanding that trans and gender diverse patients have healthcare needs beyond gender affirmation. There's an educational video I love addressing called Vanessa Goes to the Doctor, in which Vanessa is a trans woman that is going to primary care for a cough that's been there for 3 weeks. And in the bad scenario of this video, in this educational video, the doctor is like, well, I don't know much about that. And Vanessa's like, you don't know much about a cough? Tell me more. So leading with questions like, what brings you in today, to allow patients to ground set and what they are showing up for, what their goals are, and not letting gender affirmation overshadow other health needs like chronic disease management, preventative care, etc., can help keep our whole patient healthy. So you might be asking, you launched in January. What's the feedback so far? We are very proud to say that 87% of learners have completed the simulation once it started. So it's something that folks want to come back to, want to complete, want to see what happens to a patient throughout the course of dialogue. And learners report super high satisfaction, which we are very proud to rest our laurels on. Only one of our learners so far who has completed the training has given anything less than a 5-star rating, which we are incredibly proud of. We also have in our service recovery scenario in which a provider makes a mistake and then recovers from that by apologizing, we have a little free text section where folks can input what they learned from that case study. And some of the comments we've received affirm those goals and those best practices that we're trying to portray, like apologizing and taking steps to correct mistakes rather than just kind of letting things gloss over or hoping the person doesn't notice. Really proactively validating folks' identities. Again, affirming that they learned clinical information such as HRT, lab values associated with HRT, inclusive language, and of course, leaning into patient autonomy. And we're super proud again that we have been endorsed by the Human Rights Campaign. That feels so exciting to say every single time. And we were also a finalist for the Gardner's ION Innovation Award in higher education last year. We've also just recently, the LGBTQ plus health program was awarded a national award for organization institutions who promote LGBTQ plus health, in part thanks to the incredible work we've done on teaching gender affirming care. So it's all very exciting. So if you are interested in starting with teaching gender affirming care, which I can tell every single one of you on this call have eyes lights up, engaging in the chat, are so excited to do. I did drop the link in the chat earlier, and I will do so again during our Q&A to start playing, and also to the info platform for our webpage so that you can see the full details around this information. This is a continuing education credit, so if you would like to earn accreditation and continuing education credits alongside that, you can do so. There's a web-based version. You can also download it on your computer to play through it. And if you would like to get CME accreditation, you'll want to enroll through the MyCE portal. So what are things that you can do today? On an individual level, no matter your role or your positionality, you can play teaching gender affirming care. And what would be very meaningful to us is if you could identify one or more key moments that really resonated with you and share those out with your team. Tell that story of your experience going through the game and what you learned from it. And of course, apply those best practices in the next patient encounter you have, no matter your role, whether you're a front desk staff, whether you're a provider, whether you're an administrator. These inclusive practices can apply to any type of interaction you may be having. And if you are in charge of education programs, of course, this is your opportunity to consider how teaching gender affirming care can integrate into your curricula, whether that's through a case scenario or through homework or through something more substantial. We would love to be partners and consultants with you on that. And if you have institutional advocacy level, if you have a little whisper into a leader's ear, this could be something that I think would be really cool to tie to some sort of recognition or bonus achievement tied to education and continuing practice tied to professional development. It could also be a great way to learn from the HRC's Healthcare Equality Index to continue to build LGBTQ plus inclusivity in your environments. So in terms of next steps, Jessica and William have already hinted at this already, but we do want to do more to continue building out the game. Every time we present this, there are people that are like, well, what about this type of patient or this type of scenario or this type of presentation? And we're like, yes, we want to do it all. So we would love to integrate and build in more characters in gamer lingo, DLCs, things that you can add single case encounters to, new Easter eggs, new pathways. That's something we would love to do. We'd also love to promote teaching gender affirming care with our community partners. So if you have connections with any local Bay Area community partners or even national community partners that are interested in promoting LGBTQ plus health, please let us know. We would love to be in touch with them. And we've hinted a little bit at the next slide as well on some of those specific actions we hope to do, including in research, learning from the scenario and the use of virtual simulated patients to teach gender affirming care. As you can tell, we've already had positive outcomes here, but we'd love to build out a little bit more of proof around the effectiveness in this and how it can be a resource that can really replace and or enhance existing healthcare instruction and education for teaching gender affirming care. So finally, regrounding in our why. Again, the healthcare gap in teaching gender affirming care is really noticeable and is broadly insufficient. We've put a lot of intention into designing these characters in this game, informed by community experiences and informed by our own experiences of seeking healthcare, and also want to call for systemic level change. As you saw in the beginning, a lot of the health disparities that the community faces is as a result of structural barriers that are outside of our control. What we can control, though, is each clinical counter that we approach, each patient that we see, each interaction that we have is an opportunity for affirmation. And so teaching and affirming care calls upon us to ensure that each of those clinical encounters can be the most inclusive, can be the most affirming, can be the most supportive, and to maximize that for our patients who have historically received a lot of harm from medical industrial complexes. So I believe this is the end of our presentation, but before we close, just want to call out that we are 4 presenters here today, but there are much more than 4 people who are participating in building this game, not only within our teams, but also with content reviewers, both internal and external to Stanford, independent contractors who were our voice actors, our artists and part of the game, really bringing these characters to life. And I see some folks on the call as well. Dr. Elaine Xiang, shout out to you, part of our content developers and reviewers here with us today. So thank you so much. This was truly, truly a group effort. And with that, we'll open it up to Q&A. Thank you so much, everyone, for your engagement today. Please feel free to drop questions or comments into the chat, and we'll address those in order that they were received. Or if you'd like to speak out loud, feel free to use the raise hand function on Zoom. And if you'd like to remain anonymous, please feel free to direct chat to me. Thanks, everyone. We'll open it up to you. Ooh, and we've already got our first question in the DMs. This is a question to the full team. Thank you so much for developing all these characters. It feels wonderful to be represented. Is there a particular moment or key character that most resonates with you as you think about the design and development of this game? So what are those moments that you go back to and you immediately feel like you want to cry? I can start while the others think, since I've already seen this question come in. There's a moment in Olivia Lee's case, the adolescent Asian American, where the doctor asks Olivia's parent to leave the room, and the parent just kind of goes, okay, and leaves the room. And I was like, whoa, that was not my experience growing up, not with my helicopter parents. Sorry, mom and dad watching this recording. Um, and I was like, well, that doesn't feel like real to me, but maybe that's what should have happened. And so seeing that happen for Olivia was very cathartic for me, actually. Like, oh, these are what parents who from the start have affirmed someone's gender identity, their LGBTQ plus identity looks like. And so that was a great moment for me. William, Jess, Bláz, any moments that come to mind for you?
I'm happy to begin this comment, already crying. I mean, there are so many moments, like I really can't read or watch most of the vignettes without crying still at this point. But something that has really nestled in my heart that I hope can be inspiring for people is our oldest patient, Valerie, who we in the future will want an older patient. She is a transgender woman who is 52, and she's very new in her transition, and she just got her top surgery. And there's a moment in the vignette where her wife asks her, "Are you crying because you waited so long? Because like I'll kick your butt." And she's like, "No, I'm just crying because I'm so happy." And like the care that we provided in our fake clinic is what enabled her to do that. And it's truly never too late for someone to begin their affirmation journey. So I felt really good to be able to bring that moment to our course.
I can say I mean the whole dang thing is just so beautiful. And so it's hard for me not to just feel like uh, every bit of it just coming together was an awe moment. But I think one of the biggest moments for me as we were working on this, we spent a long time. I did a lot of writing over a holiday break. Every morning I would wake up and do some script writing. Actually, Elaine and I both worked really hard on Rock's case together during that break. And when the illustrators are fantastic, Kat is one of our illustrators, put it all together, and then whenever the community member who did the actual vignette drawing of Rock's interaction with his sister. It's one thing to write all of the script out, but once you see somebody like hand drawn your kind of interactions you dreamed up in your mind, and then the voice acting that went on top of that, um, the moment where Rock like has his first stubble and he starts crying after a moment where he was struggling with his own body image and working out, and his sister's there talking to him, but she says, "Oh my gosh, you have facial hair," and they're cooking dinner together. He reaches up and touches it, and then he starts crying, and she's like, "Are you crying?" And he's like, "It's the onions." But yeah, I'm crying and it burns. And I just like love that moment because it's so beautiful. It's such a moment for Rock where he really sees change happening to him that means a lot. But it also has his sister there, like offering him love and celebrating him. And that moment just always gets me.
That's so beautiful. And we've seen a couple questions in the chat as well, which we can get to. But I saw, Chris, your hand was up earlier. Would you like to ask your question out loud?
Sure. Thank you so much. Chris Durkin, he, him. I'm a new program coordinator, School of Medicine at Tri-Valley, and I'm actually heading into a hospitalist education team meeting right now. So I have to go, but I would love to just ask, maybe after the fact, what the best way is to connect to the medical education team with y'all to make this happen. Because I support all that stuff. So yeah.
That's a great question. First of all, this presentation is being recorded, so feel free to share this out with them once it's ready. But we do already have a couple of shorter trailers, about like 2 to 10 minutes in length, that you're welcome to share as a little preview of the game. We'll also be publishing on Steam soon, which is exciting. So if you want a handheld way to play the game, there's a way to do that as well soon. But in the meantime, we will send the link out to this recording, to our info page, and to the actual enrollment page of the game, which you're welcome to share out with your team. Thank you for asking, and enjoy your meeting with them. Open with this, actually. Open with this presentation when you check in. And we can certainly develop a one-page flyer or promotional materials for that. But as Bláz linked in the chat, the website has a short form trailer that you're welcome to share out as well. And we received a question about how we can connect community partners with the team. Of course, you can feel free to email us individually or at our group email, which I'll put in the chat here again. This is a group email that's monitored by the full team, so feel free to connect with us at any point. Alrighty, folks. Well, it is officially past 1 p.m., so thank you so much for being a part of our presentation. We'll stay on for just a couple more minutes after the recording ends in case folks have additional questions to ask. But thank you so much for being such a great audience. It was so enjoyable to present to you, and please move forward with promoting, sharing this broadly. We would love to hear your feedback and your playthrough commentary. So thank you so much. Enjoy the rest of your day and your weekend ahead.